you are disregarded sometimes.
I stopped dinner parties because I couldn't keep up with what was going on.
And they say, oh no, it doesn't matter. And it really matters an awful lot. It really matters an awful lot.
But they will still treat hearing loss as a bit of a joke. And that's sad.
I feel that they're treating us or thinking of us as idiots, which we're not. We're normal people.
People who don't have a hearing loss can't understand the difficulty that we have.
Healthwatch Hampshire spent time in late 2015 visiting lip reading groups across Hampshire to hear from people with hearing loss what it is like for them to use the NHS and other services. We were interested to see what local services could learn and change to improve for people that struggle to hear. Here are some of what we found out.
I think basically getting people to realise that I can't hear and go on remembering it as they go on talking to me, because you just have to stop, please, I'm hard of hearing, stop please, I can't hear you.
I think hospital-wise it's that if you say that you're hard of hearing, it seems to go in one of their ears and out the other.
The attitude, no, I'm not saying that people are indifferent to the deafness, but it seems to be the same everywhere I go, outside the National Health. There's the sort of people who don't seem to get that this is a serious disability and it can hold me back. It has done, held me back for years. So that does seem to be the same sort of case for the National Health as any other organisation in the country, in my experience.
People with hearing loss are not taken seriously because people with hearing do not understand what it's like to have hearing loss.
Quite often, the person, the health professional, whether it be a consultant, nurse, whatever, they'll talk to you about your illnesses and things, and then all of a sudden they'll turn away and either look down at their notes and things, and so you miss what they're actually saying.
When it comes to, say, a dental practice, that's a real issue because the dentist is invariably standing behind you and he invariably will have a mask across his face. So it's almost impossible, and even though you indicate that you do have hearing difficulty, they're often too busy to be able to distract themselves to concentrate on your issues.
Seeing people's lips, that is so vital to a lip reader. Without the face, without the lips moving, it's a loss. Absolutely non-starter for me.
But you can't hear, you can't concentrate, nobody will take the time because they're running on to the next person.
Hearing loss cannot be seen. If you're blind, they can see you're blind. If you haven't got hearing, they can't see it.
This is stopping people from being independent. They don't want to have to take somebody to the doctors, to the bank, to the station to buy a ticket. They want to be able to do it themselves.
I would personally think that more training should be given to make them more aware that you are hard of hearing. They think it's just hard of hearing, and that doesn't stop there for some people. I have Meniere's disease, and that doesn't have any balance, and also I have to deal with distortion, so I don't get the true sound.
Speak slowly, clearly, and look at me.
Everybody's different, and you need to find out, talk to them and spend time with them to actually find out what their problems are, and then you can refine them.
Put themselves in the patient's seat and be a little bit more, visualise things more and what sort of problems there are going to be.
Just being aware of basic sort of lip reading needs, things like, if you're a doctor and you're making notes and talking and the patient is sitting to one side, sometimes it's difficult. And as a patient, you sort of say, "Can you say that again?" You feel a bit silly doing that.
Generally, I think, is to ask people if they are hearing okay, because I've noticed myself that people with a hearing problem often nod and smile. Yeah, that's okay, it's fine. And the health professionals, obviously, they're concentrating on their own subject area, and they're trying to get to the root of a problem, but they often don't realise that the person in front of them isn't hearing everything. So maybe they could ask first, "Can you hear me?"
But quite often you're treated as if they don't understand at all. Put it that way, they don't understand what the problem is because they can hear.
It would be much better if you had a visual aid, or if it was noted on your card that you were deaf or hard of hearing. When they come into a waiting room and there's chatting going on and they don't speak very loudly or they don't come right in, they just say your name at the door, it's very easy to miss. If it was actually written on your case card, they would know you couldn't hear very well.
By having records noted, and through the records, because within your file you've got different sections. If you need a test, they bring out one piece of paper and they send it to that department. That department's got a little mini folder and there's nothing else in it, so it should go all the way through.
I had an audiologist, and because I mentioned I went to lip reading, she said, "Oh yes," but until I mentioned it, it was not mentioned. And I've spoken to other people who go to the audiologist. Lip reading is never mentioned to them. Services are never mentioned to them. What other services they can get, social services they can get.
Them to be able to issue us with maybe a bit more leaflets, or maybe there should be some leaflets there to help us to see what is available for us to be able to access things at home, and in general to give us a bit more information.
Signposting on to other services, because I think a lot of people see the NHS as a great big thing out there. They're busy doing all their other stuff, which they do very well in a lot of cases. But hearing, there's all these other people in the private sector, Boots, all the glasses people, all lining up to get your attention and take your money away, when a lot of people do not realise now that the National Health has caught up in the hearing aid world.
I think if the people were perhaps to themselves wear hearing plugs for a few days, they would understand more of what we're going through.
Making sure that the loop system is working. The number of times I go in and I say, "Is the loop on?" or "Have you got a loop?" You know.
In a hospital, doctor's waiting room, it would be very good if there were visual display boards. People are not going to hear when it's their turn to go in. They're not going to hear somebody call their name. Visual display boards would make such a difference.
Enlarge the information leaflets that they give you if they're giving you a hearing aid. More information could be in there with regards to lip reading groups.
A centre where you could go and see the equipment that's available to us. If there was a centre in Portsmouth, we could go up, we could use the equipment, borrow it, bring it back, etc.
I think the provision of hearing aids automatically, it is such a fight in the initial stages to get them.
The one very important thing would be to provide lip reading sessions throughout the country, so they had somewhere to go to learn the skills to manage their hearing loss in a hearing world, to interact with other people so that they could learn from them. Lip reading and managing hearing loss classes are essential.
Well, I think these classes are absolutely fantastic. They really are fantastic. But it's the fact that everybody's in the same boat.
Information, lip reading classes that are seen as valuable as other classes for other disabilities. It's actually been a lifeline to me.
I think groups like this are very productive and very helpful. It helps boost your confidence to be able to admit to other people that you've got a hearing difficulty, because it's not easy doing that.
Well, I think that we ought to have more lip reading classes. I mean, I live in Chichester, and there are none in Chichester. I think West Sussex, they've got them in Hampshire, but I have to come into Hampshire to actually access the service, and it's so important. It's given me far more confidence to do that, and it's also a support group.
Marvellous.
It's you know, we all get support from one another, and we've each got our own experience, and we can say, well, have you tried this?
Yeah, we
have
can
you
help
done
each
that?
other.
We help each other.
It's always been the poor relation. Blindness you can see, deafness you can't. But now, at last, a lot of research is going into all aspects. I say to the students, if any time's a good time to go deaf, now is.
Assume everybody is hard of hearing, and then maybe you won't go so far wrong.
Not a bad idea.